Today, I'm bravely doing a full face makeover on one of my friend's mums. Hi guys, my name's Dr Sarah Tonks. I'm a cosmetic physician in London. Today I am going to be treating one of my friend's mums because her daughter is getting married very soon. So as you can see, we did have a bit of an incentive to really push the envelope out to make her look gorgeous for the wedding. Okay guys, let's take a look. So first of all, sorry, her head is slightly tilted off to one side. Some people, they just have a bit of difficulty sitting straight up. We should get a chiropractor to come along maybe to some of these filming sessions to, make sure that there's like a string going from the top of their head to the ceiling. I have terrible posture, by the way, so I'm not judging. So, what do we see here? Well, I mean, obviously she looks great anyway. What can we do to help her feel her best for her special day? So I think it goes without saying that she does have a few like fine lines around the eyes on both sides, and she does have a little bit of crepiness underneath the eye as well. We've got a little bit of hollowing in the temples, and we have a tiny bit of flatness in the central part of the forehead. It never hurts to improve the jawline or the cheek. So you can see here, if I just draw along the jawline, we've got a little bit of pooching right there where the jowl is. And I'm going to try and improve that by vectoring everything upwards. Look at those lips. Her lips are great, aren't they? And that's all natural. I think she has a great nose as well. Bit of a chin crease here. I think the message with her is really just going to be a little bit of lifting, a little bit of vectoring, and a little bit of skin improvement, because she already looks fantastic. So it's just a question of trying to improve that very slightly, give her a bit more of a glow. Let's just have a quick look at her smiling before we go over to the video. Look at that. She has a beautiful smile. She looks exactly like my friend when she's smiling. Okay, let's start with the basics. So we're going to do some Botox first. We're doing the forehead, the frown lines, crow's feet, that's kind of important for her. And we're also going to do the lower face. So we're doing this muscle here, the mentalis muscle, and also the DAO. And you can see that now I'm treating the platysma and underneath the jawline here, just to try and help the jawline look a little bit more cut. After that, I'm now drawing on the skin. So first of all, I'm going to do the front part of the cheek using filler, and then we're treating on top of the cheekbone itself. And this is something that I do for a lot of people because many people could use a bit of filler there to help to lift up the tissues. Next, we're going to do the temples. This is one of my favorite injections actually. It tends to absolutely eat filler because you need to use quite a lot to get a good result, but wow, it does make a difference. And now I'm doing a technique that I learned from Arthur Swift. It's multiple tiny injections in front of the ear to help give a little bit of lift and vectoring. Then we're going to use some products in the chin crease and touch up the left temple. I've switched over here to using a 32 gauge needle for the forehead. If you've watched my videos before, you'll know that this is something that I do quite often. Mainly in that area actually, or anywhere where I want to get a greater degree of control. The reason for that is this 32 gauge needle is 0.3 mils as opposed to 1 mil. So you can imagine that with the amount of pressure that you put on the syringe, it's a lot easier to have a tiny, fine detail control if the syringe is smaller. And this is another injection that I do for many people. So we're doing the base of the nose here because as you get older, the hole that your nose sits on, it tends to get wider. And now we're going to switch over to using a cannula. So remember, a needle is used if you're trying to get product into a specific point, whereas you use a cannula if you're trying to reach a wider area. Now I'm using the cannula in the cheekbone area, again to try and get a bit of lift and vectoring. Then we're going to treat the angle of the jaw. I'm going back to put some more in front of the ear with this tiny micro droplet technique, again the one that you saw earlier in the video. And now we're going to do the point of the chin. This is to really make the face into a bit more of a V shape. I'm doing the corners of the mouth now. This is to make her smile a little bit more happy. So that, in conjunction with the Botox that we put in the DAO here, will just help to elevate the mouth corners. Okay, now you're going to see something that I don't think I've done on any of the previous videos. I'm just going to put one single PDO thread per side. Normally I would do more than this, but you know, because we've got the wedding coming up, I didn't want to go too crazy, so I literally just put one in each side. And now we're doing the blood draw for the PRP. And lastly, I'm putting the PRP underneath the eyes. We do that last because you get quite a lot of swelling. Okay, so let's have a look at what we've got. So I think the biggest improvement that I can see here is definitely around the eyes. So you can see that these little fine lines that she had earlier, pretty much gone. And even the skin texture underneath the eye here, a little bit improved. The whole area just looks a bit smoother. I don't know if you guys can see, but she has had a little bit of a brow lift, which was achieved putting the filler in the temple and also doing the Botox across the forehead. I've treated with filler the central part of the forehead, but I'm not sure whether or not you can actually see it on here too well. There is almost like a depression here, which is not evident here. It's quite subtle. We've definitely got an improvement in volume in the cheek area and also the jawline. We still do have these pesky jowls. You know, ideally what I would want to do, given that we've replaced all the volume that I would like to replace, I would really love to put a few more threads in here. I don't know, maybe we could get her back at some point to put some more in. If I were to put threads in, I'd again go from in front of the ear, at the top of the ear, like so. And then maybe from the angle of the jaw, put a couple in that direction. Threads are not the easiest procedure to have done. It can be a little bit sore. Chin looks nice though, doesn't it? Much more feminine. Going forwards, what else could we potentially do? Well, she has lost a bit of volume here, just underneath the eyebrow. That's certainly something we could look at filling. Remember guys, that part is called the A-frame. As I mentioned, we could put some threads in. She's going to need another session of PRP, probably about a month after these pictures were taken. If she really wants to get some really good lifting going on, we could potentially do some ultrasound to help further tighten the tissues of the mid to lower face. And we can take that down onto the neck as well. We could maybe look at doing some Profilo or a similar product, some kind of injectable moisturizer just to give the skin a bit more of a glow. But I think she's looking pretty good. She's certainly wedding ready. Okay guys, so that's it for this week. I hope you enjoyed the video. I'll be sure to let you know how the wedding goes when it's time. Don't forget to come back next week where we will be doing another non-surgical makeover. And in the meantime, don't forget to like, comment and subscribe. I'll see you next week.